Now to our health spotlight, in which TV medical expert and former Surgeon General Dr. Jerome Adams. He joins us now. Dr. Adams, let's start with something that Dr. Mary Gillis has been reporting on, this new liver illness popping up in young children in the United States and around the world. So what are we dealing with, and should parents be alarmed?
Well, parents should not be alarmed, but they should be aware of what's going on. The Indiana Department of Health and CDC are working to identify individual cases or groups of cases of hepatitis in children in Indiana. I want people to know hepatitis is an inflammation of your liver that can be caused by viral infections, alcohol use, medications, or other medical conditions. And this goes back to November of 2021 when doctors in Alabama first notified CDC of 5 pediatric patients who had hepatitis, including 3 with acute liver failure. All of these patients tested positive for adenovirus. All were previously healthy. And then they found 4 more cases for a total of 9. Worldwide, there have been 169 cases. 17 of them have required liver transplants, including 2 of the Alabama cases. And so that's the reason for concern. Now, adenovirus has been correlated, but the CDC and the Department of Health are looking to see whether or not it's causing these cases of hepatitis. Adenovirus is caused the common cold. They're spread by close personal contact, respiratory droplets, or touching surfaces that other people with adenovirus have touched. They most commonly cause, again, respiratory symptoms, but can cause stomach upset, eye problems, and neurologic disease. So what parents need to know is that any child showing signs of jaundice, which is a yellow discoloration of the eyes, the skin, and the urine, could have hepatitis and should be evaluated by a medical professional as soon as possible. Very rare that this could occur, but we are seeing increasing cases. So we just want parents to be aware, and we want providers to be aware.
Good information there. Dr. Adams, another note about kids that we want to talk about. As you very well know, the CDC today estimates 3/4, 75% of all children have been infected with the coronavirus. Meanwhile, we're still waiting for a vaccine for children under the age of 5. And I know that you've been publicly frustrated with the pace of the approval. So when will we see it? And what do parents of young kids do until it's approved?
Well, we recently heard that Moderna is going to submit for emergency use authorization by the end of April, and that by the end of May, Pfizer will submit for emergency use for kids under 5. So we're hopeful that we'll have an EUA decision by June. That's frustrated a lot of people because it continues to be pushed back, and also because Dr. Tony Fauci was on the news this past weekend saying they may delay review of Moderna's submission until they have Pfizer's at the same time, because they don't want to confuse people by approving one and then approving a second one before they know whether one of the two works better. And also, there are 2 different dosing regimens. The Moderna is 2 doses. The Pfizer is 3 doses. So what parents need to know is that right now, unfortunately, you're on your own, and you're on your own in a world where fewer and fewer people are taking precautions. So you need to understand if your child is high risk. Does your child have asthma? Does your child have diabetes? Are they immunocompromised? And if they are, then you need to make informed decisions about whether or not you're going to take them into public environments. And if you do, whether or not you're going to have them masked or not. One of the things that you can do to protect them at home is to make sure the people around them who can get vaccinated and boosted are vaccinated and boosted, so they're not bringing something into your family, particularly, again, if you have a child who is immunocompromised or at risk. But know that in most cases, children under 5 are at low risk, particularly if they don't have another medical problem. And you heard that 3/4 of kids do have antibodies, according to the CDC, so they have some protection. So don't want parents to be alarmed, but we do want to protect those parents out there and give them a choice if they have kids who are immunocompromised.
Dr. Adams, one last question for you before I let you go. Another note that came out today, new guidance about aspirin and preventing heart attacks. The new guidance says people over the age of 60 should not take aspirin every single day to prevent heart attack or stroke. So why the change? Is there any danger to it? And what should you be doing if you're already taking an aspirin a day?
Well, this is a big deal. And we got new news out, new data that's telling us that when we look at everyone who's been on aspirin, that particularly if there's someone who doesn't have pre-existing risk factors for heart attack or stroke, that their risk of actually brain bleed or a stomach bleed is slightly higher than the protection that they get from taking a daily aspirin. So these new recommendations reflect that new knowledge, and they're telling people, hey, if you don't have a reason that your doctor's already said that you need to be on aspirin, don't just take it just to take it. The danger here is that we don't want a whole bunch of people to stop taking their aspirin if they are at risk, because many people do have risk factors for cardiovascular disease or stroke. Make sure you talk to your doctor and make an informed decision about whether or not to start aspirin or to stop taking your aspirin. Don't stop taking your aspirin on your own, but do know that if you're someone who is completely otherwise healthy, the new recommendations suggest you don't and shouldn't be taking an aspirin every day to lower your risk of heart attack or stroke.
Wish TV medical expert and former Surgeon General, Dr. Jerome Adams, thank you for taking some time, sir. We appreciate you.
Thank you, Phil. We covered a lot today, but there's a lot of important information out there. Make sure you follow Wish TV, follow up with Dr. Mary Gillis so you can understand how to stay safe.
Sounds good. We'll talk to you soon. Thank you.